Hi, I'm Dr. Matthew Norton, founder of People Plus Purpose, and your host on this episode of the Truth Behind Dentistry podcast. And today I have the amazing Dr. Marielle Pariseau with me. Marielle is a change architect, coach, mentor, inventor, author, and speaker with a focus on social impact. It might have been easier to say the things that you are not, Marielle. In addition to her doctorate in dental medicine, she has completed many special courses and certifications, and her focus is on risk assessment, prevention, and education. Welcome to the podcast, Marielle.
Thanks for having me, Matthew.
Absolutely. I've really been looking forward to this conversation as we'd had a chat in advance of this, and I love your focus and the topic areas we're going to walk into and cover as much as we can today. So I appreciate you joining us. Maybe first of all, from a broader starting place, what do you see in terms of, say, a biggest pain point that you feel like you'd like to speak to in the dental world?
Yes, that's a big one. From what I see happening in dentistry right now, the focus is still very much on a local treatment for a disease that is considered local, where I really feel that caries is a systemic disease. What leads to the downfall of tooth enamel doesn't affect just tooth enamel, it affects all cells in our body. So I would like to see dentistry take a broader view on what needs to be done in dentistry. So pain point, focusing too much on the local treatment, and focusing very much still today on the restorative aspect of dentistry, where I really feel we need to move more into education and prevention, because this is where we can make the biggest difference.
I like that, and well and succinctly said. And sometimes it seems like, haven't we gotten further, or why haven't we gotten further in some areas like this? And I guess that's maybe a whole separate conversation as to why on some of these things. But so when you think about how we need to pivot, then what, and maybe in general, your solution ideas, like where would you begin when you say, okay, we need to transcend the local focus or the restorative priority and shift elsewhere? How do you begin to do that? Or what would you say, where do we start?
The big pivot has to do with ourselves, dentists, and how we perceive ourselves and our work. When you think about it, dentists operate at the confluence of nutrition and health, at the confluence of tooth decay and metabolic diseases. When you start thinking of yourself that way as a dentist, then there becomes a very urgent need to shift our perception of self from being a local care provider in the mouth only, moving from that to consider ourselves as primary healthcare providers. That what we see in the mouth, when we realize that what happens there is only a precursor to what's happening in the rest of the body, then we can start influencing healthcare in general. And when we achieve that, we will change the course of healthcare. And I also feel that healthcare cannot be complete without including data from dental clinics. Without that, healthcare cannot be complete. We cannot have all this part of medicine apart from the rest of the body.
Given the fact that there is, and maybe has been for quite a while now, mounting evidence of the oral systemic health connection and how important all that is, and it's can't be easily compartmentalized, not effectively so anyway. What do you think is holding this back? Is it, would you say it's greatly because those connections are not made adequately in dental school? So as people are coming into the profession, they've not been maybe even philosophically prepared to see that larger connection? Is it that there's so much time, effort put into becoming masterful technicians in a local area that, I mean, I've got that. How am I also supposed to see myself as connected to a larger health picture? Or how would you explain some of this?
Wow, that's a huge question. I've been out of dental school since the earth was cooling. So it's been a while since I've been in dental school. My personal experience has been in the first year, especially, we were studying with medical students, and we were focusing on histology, physiology, chemistry, like all these big topics. We were all together with medical students, and that was great. However, like you said, once we moved into the practical aspect of fixing teeth, the focus became very mechanical. And I have to say this, I mean, being a mouth carpenter is so yesterday. We have to move beyond that. And I feel that for me, what happened when I was in dental school is there was a disconnect that happened between the first and second year and the third and fourth year, where in the third and fourth year, we focus very much on the clinical aspect of dentistry and how we restore teeth. But in first year, that's where we learn histology. And that is such an important thing with which we must never lose connection to. Because mature dental enamel is acellular. That means it does not have a capacity to regenerate, which makes teeth ideal sentinels. They fall victim to dietary imbalances, toxic diets, much sooner than other organs that have cellular turnover, like the pancreas, the heart, the liver. So what we need to learn is to see ourselves as very important part of health in general, become primary care practitioners, and start alerting our medical colleagues as to what we see in people's mouth, and let them know, like, wow, enamel, the hardest tissue in the whole body, is collapsing right now in this patient's mouth, in this 5-year-old mouth. What is it that we can start working on together to prevent damage to other tissues that's going to take decades before it manifests itself? So we can be kind of the litmus test of what is happening to health in general, and how can we contribute as full-fledged medical providers to change the course of health.
Yeah, to me, that's exciting. And I know in your TEDx talk that you did, you talked about teeth being the body's kind of part of the body's early warning system. So that's what you're talking about there is the ability to read that and see a larger message about how the body is behaving, or where the body is struggling, right?
Exactly. And when you think about it, I mean, teeth don't come to the dentist all by themselves, right?
No, I've never noticed that anyway. So
Right. It would be so much easier, but they usually come with a human being, and they are part of an ecosystem that we need to respect. So it is more than time that dentists move and start seeing their role in healthcare as full-fledged team players. And we must start participating in a much more active way into the whole picture of health.
yeah, early warning system. I mean, I like that. And to me, that seems like a compelling role to be able to contribute, to be able to say, I'm privy to early data. I have an inside track on things that are going to increasingly matter across multiple fronts in years to come, and that I have a voice to contribute to this, into this larger healthcare community that needs my input, for the patients need my input, the world needs my input for the sake of everybody's well-being moving forward. And I think also this would help solve a lot of doctors that I talk to that are bored after a point, I think, of a lot of the rote mechanical daily activities that they're involved in. Because I think, to your kind of humorous statement about being mouth carpenters, I think for many people, it's like, I've kind of mastered this. I could do this in my sleep. But if they saw each unique human being as part of a larger health picture, and we can communicate about that, that sounds exciting to me. I think many others would get involved. Is that your experience when they have kind of broached this vantage point?
It is. It will take a long time, though, because things move quite slowly. But imagine yourself as a dentist, and you can begin to influence healthcare in general. You see a 5-year-old with early childhood decay in your practice, and then you start working with that child's pediatrician or family physician to determine what is the root cause of this problem. And we know what it is. It's sugar, it's highly processed foods. And these are the elements that usually lead later in life to other problems like diabetes, hypertension, coronary heart disease, and so on, metabolic diseases in general. So if we can start seeing ourselves as influencing healthcare, as helping medical practitioners help their patients to avoid certain diseases they're on the path of achieving in life, which is an achievement nobody really wants to have. So if we can change the course of healthcare, I think we will find a lot more satisfaction in our work. This being said, though, the system right now is still geared to remunerate dentists and most healthcare providers for rehabilitating, restoring. So for being not proactive, but reactive to disease. So we, just not dentists, but healthcare providers in general, are very much like disease managers. And so we need to move more towards healthcare as opposed to being disease managers.
Yes. Which has to begin somewhere before somebody's ever going to develop the confidence, the competence to engage in those conversations, right? I mean, can I feel comfortable as a dentist then reaching out and communicating and feeling like I'm a key part of a team, a healthcare team? And then is that audience going to be receptive to my input? Can we train that in? And it has to begin with some people starting, right? The system is unlikely to suddenly shift and begin to embrace all this. Just like you say, we are being much more reactive than proactive for many different competing forces at play here, right? Economics being one key element of that. But I mean, what else would you say in terms of, you talk about kind of dentists reconnecting teeth to the rest of the body, and this idea of sentinels. What else would you say more about that as to how that feeds maybe into this ability to have more conversation?
Mm-hmm. Mm-hmm. Number one, we need to see caries as a systemic disease. It's not an isolated event that happens only in the mouth. Caries is a systemic disease. And from that point of view, caries also becomes a sentinel health event. And there is a definition in the dictionary about what a sentinel health event is. And typically it's a preventive disease that keeps on occurring, exposing the fact that our care for that disease is inadequate. So we need to review this. And I think the first step, recognizing caries as a systemic disease, is a step in the right direction. And from that point on, it requires courage, but one little tiny step at a time. For all dentists who are connected to a hospital system, who do some cases under general anesthesia in a hospital, start connecting with the pediatricians and the family physicians who operate under that same roof, and start talking about caries as a systemic disease. That enamel, after all, is the hardest tissue in the whole body. It's more than 2.5 times harder than bone. When it collapses, this is serious business. So moving caries from what we used to deal or talk about as tooth decay to caries, the systemic disease, is the first step. And open up, talk about it to physicians. If you're in a hospital, insert yourself in grand rounds, and start talking about caries as a systemic disease, and how it, by working together, we can prevent other chronic non-communicable diseases from happening. We'll be much better off from that point of view. What else? The other thing is finding little things that you can do in your community, opening up, because for me, nutrition is a big culprit. There's sugar everywhere in everything, and we need to start talking about that. And actually, Dr. George Shepley, the current ADA president, talks about the need for dentists to connect nutrition and health and be more involved in that aspect. So there's little tiny steps that I like to call trim tab steps. Just when you're at the bank and you see lollipops at the teller's counter, speak up to that. There's no need for lollipops in a bank. And for the crying child who comes in with a mother who has too much on her plate to begin with, a sticker will go a much longer way into making that child happy and will not contribute to disease. When you see a chocolate on the pillow of the hotel you visit, talk about it, expose the fact that maybe a toothbrush would be better. Little things like that. Or if you have children in elementary schools, get involved with that. There are many classrooms where there are still candy rewards for kids who do something right, get the right answer. There is no need for candy rewards in the classroom. And yet, these teachers mean well. It comes from a perspective of love that they offer these rewards, because they know that rewards work really well. But these are terrible. So visiting the school and talking about candy rewards and offering a roll of stickers to that teacher and say, you know what, when you run out, I'll replace them, because most of these teachers buy the candies out of their own pocket money. So be part of the community. I like to talk about weaving oral health into community. And it just takes little tiny steps like this. As far as speaking with our medical colleagues, that's a tough one. You know, dentistry and medicine divorced more than 100 years ago. It was a marriage that never went well. When we want to reintegrate the ranks of medicine as full-fledged primary care providers, we need to approach it well prepared and ready to be rebuffed, ready to meet with physicians who are going to think that whatever work we do is irrelevant, that it doesn't really matter, where it does very much. And we need to be ready to explain why it does matter, to prevent tooth decay, and to talk about it together, because we can prevent other diseases, other chronic non-communicable diseases.
That's good. Very good. A couple of things I was in my mind there thinking is, I like the simple action steps for involvement, to say that it doesn't have to be some major, civilization altering steps that somebody needs to think I need to take, but small things like that, especially that can influence children and that sort of thing. And also that it would make sense that the more that we can personally understand, go deeper into the connection between nutrition and caries, the more we can see the nutritional impact across systems, including the dental exposure that's showing up on a daily basis, then should help give more confidence, more ability to articulate these things to other healthcare colleagues, and then maybe beginning, would you say, with looking at, well, who are some of the more holistically minded people in the healthcare, your healthcare community, that maybe have had some dawning awarenesses themselves that are transcending some of their training, right? To say, hey, maybe it's not just a deficiency of this medication that people are suffering from, but maybe we need to look at an altering diet, and maybe those are some people you could begin to collaborate with, have conversation with, and maybe find a joint project in the community that could
Yes.
work.
Yes.
That sounds
Indeed.
kind of exciting to me.
Yes, yes, indeed. And one project that I've been doing for years is I go into elementary schools and I do workshops with grade 2 students. And I usually kind of center that around National Children Dental Health Month, February, but it spills into January and into March. But in the middle of that workshop, we asked the children to organize a series of 12 beverages from the least amount of sugar to the most amount of sugar. And it is so interesting. One of the beverages that gets a bad rap in every single classroom is Coca-Cola. It always gets positioned in the most amount of sugar. And when we reveal at the end, Coca-Cola is in the middle. Because the chocolate milk and many juices or smoothies have a lot more sugar than the Coca-Cola. So that's always a big surprise for the kids. And what we started doing this year is we added, I'm going to call it a power bar and a candy bar. And typically now the kids put the power bar at the lowest amount of sugar and the candy bar at the most amount of sugar. And when we reveal at the end, they both have the exact same amount of sugar. So that's a big mind opener for the kids and the teachers who are in the classroom. So this could be done going 1 or 2 dentists, or rally a nurse, a physician to come with you. And it's fun to do. And it's amazing what I've learned from the children as I've been doing this exercise. And one thing that I just learned this year was kids all assume that bacteria are bad. All bacteria are bad. So this has been an addition this year to say, like, no, there's a lot of good bacteria, and we have to make sure we feed them. And those good bacteria love fiber. So instead of drinking juice where you have only the sweetness of the fruit without the fiber, eat the fruit. So things like that need to happen at so many levels. In elementary schools, I think, is a very good place to begin, but it needs to also become part of dental offices. That maybe one of the hygienists could learn more about nutrition and spend more time educating patients about nutrition and the impact it has not only on the mouth, but on the whole body, or even hire a nutritionist to work within the walls of a dental office. So we need to bring some elements of medicine within the walls of our dental offices, and we need to expand our view as healthcare team player to well beyond the walls of our dental offices.
Well, I agree absolutely with everything you've said. Not that you were looking for my agreement, but I do. And this is fascinating to me. And I'm hoping that there are people listening to us who are equally fascinated, that there's a next step that has come clear to some, and that for others, there's like a first step, like I need to, you're right, that makes sense. I need to do something. So assuming that, and people are captivated, then tell us if they want to connect with you, they want to know more in this area. How would they reach you? How would they best connect with you? And what other maybe additional resources or next step would you encourage?
Wow. Well, I do have a website that's called Teeth First, all in one word, just teethfirst.org. And there is a part of that website that's addressing to oral health professionals. There's another part that addresses to children. And that was the very first part I created quite a while ago, but it's still very relevant. And on that part of the website, I talk about teeth as little superheroes, but like Superman, they are very sensitive to acid, just like Superman loses his power when he's exposed to kryptonite. So I talk about that. So that website, teethfirst.org, there's my TED Talk. It's about 16 minutes long and it has more than 1 million views now. So I'm really pleased with that.
Nice.
But I say a lot about what is important to consider and what are the small steps at the end of the TED Talk. There's a lot of little small steps suggested at the end for all people, teachers, parents, hoteliers, bankers, everybody. So these are two things. There are also websites that link like oral systemic health. And I would think that you have a URL address for that one.
Yes,
It escapes me right now. What is the URL address for that one?
I'm not sure off the top of my head, I know, but we can make sure that anybody's connected to that. So in our follow-up, so.
And there's a book that I'd like to mention that is also important, and it's called When Are We Going to Teach Health? And I think that's, I'm going to try to grab it without demolishing everything here. So when are we going to teach health? And I think Duncan Van Dusen brings a very important point here, that we teach children STEM, like science, technology, engineering, math, arts. We teach all kinds of things, but the truth is without health, we have nothing. So teaching health becomes very, very important. And because I'm a dentist, I'm slightly biased, but I feel that if we could include the teaching of oral health in elementary school, in kindergarten, grade 1 and 2, so that kids would be better equipped to take really good care of their teeth, then the rest of the body will follow. It's all connected.
Yes.
So when are we going to start teaching health?
I like
Thank
that.
you, Dr. Van Dusen, for this book. It's amazing.
Yeah. Awesome. Awesome. Well, thank you so much. This has been a fascinating conversation. I would love to come back around and dig in a little bit more, maybe in a subtopic or two in a follow-up conversation. But this is great, and I appreciate your time. So thank you very much for joining us today.
Thanks for having me, Matthew, and I'll be happy to come back if you want me.
Okay. Thank you.
Okay.
So for everybody watching, this again has been Matthew Norton, and this is the Truth Behind Dentistry podcast. And we've been with Dr. Marielle Pariseau, and I hope you have thoroughly enjoyed the conversation and you will take one action step to apply some of the insights that we talked today. And so I look forward to our next conversation on the Truth Behind Dentistry podcast. Thank you.